What really happens to your prostate when you masturbate every single day? Hello, gentlemen. I'm Dr. Ken D. Berry, a urologist with over a decade of experience specializing in prostate health and male sexual wellness. Today, I'm answering one of the most common questions I get asked in my practice, but almost never hear discussed openly. If you masturbate daily, what's actually happening to your prostate? Is it helping? Is it harming? What changes occur inside that walnut-sized gland? The answer is going to surprise you because what happens depends entirely on your age, your technique, and your overall approach. And the research shows some fascinating changes that every man needs to understand. Before we dive in, hit that like button, comment below where you're watching from, and subscribe so you never miss critical health information for men over 50. Now, let me reveal what's really happening inside your prostate. Before we talk about daily masturbation, you need to understand what your prostate actually does. Your prostate is a small gland about the size of a walnut located just below your bladder and in front of your rectum. It surrounds the urethra, the tube that carries urine and semen out of your body. Your prostate produces fluid that mixes with sperm to create semen. This fluid protects sperm, helps them move, and provides nutrients for their journey. During ejaculation, the muscles of your prostate contract forcefully to push semen into your urethra and out of your body. As you age, your prostate naturally enlarges. By age 60, about half of all men have an enlarged prostate. By 85, that number reaches 90%. This enlargement can cause urinary problems, discomfort, and other issues. Prostate cancer is also incredibly common. Excluding skin cancer, it's the most common cancer in men. About 1 in 8 men will be diagnosed with prostate cancer in their lifetime. So when we talk about what happens to your prostate with daily masturbation, we're talking about changes to a gland that's already undergoing constant transformation as you age. Now let's look at what the research actually shows. Here's the first major change that happens with frequent ejaculation, and it's positive. A landmark Harvard study tracked nearly 32,000 men for 18 years and found that men who ejaculated more than 20 times per month reduced their prostate cancer risk by about 20% compared to those who ejaculated only 4 to 7 times monthly. 20 times a month is roughly 5 times per week. If you're masturbating daily, you're at 7 times per week, which is even more frequent. An Australian study found that men who averaged 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70 than men who ejaculated less than 2.3 times weekly. That's a massive protective effect. Here's what's happening biologically. Frequent ejaculation helps clear potentially cancer-causing substances from the prostate. Think of it like flushing a drain. When prostate fluid sits stagnant for long periods, harmful substances can build up, potentially leading to inflammation, cellular damage, and increased cancer risk. Daily ejaculation keeps that fluid moving. It prevents buildup. It reduces the time harmful substances spend in contact with prostate tissue. One patient, 62 years old, with a family history of prostate cancer, was terrified of developing the disease. After discussing this research, he committed to regular ejaculation approximately 5 to 7 times weekly. 5 years later, his PSA levels remain excellent, and his prostate exams show no concerning changes. Daily masturbation creates a flushing effect that protects your prostate from cancer development. If this surprises you, hit that like button right now. Now, here's where things get more complex. The effects of daily masturbation aren't the same for all ages. Research shows that frequent masturbation in young men, particularly those in their 20s and 30s, may be associated with slightly higher prostate cancer risk. However, for men in their 50s and beyond, it lowers prostate cancer risk significantly. Why the difference? Researchers suggest that young men genetically predisposed to hormone-sensitive prostate cancer may be at higher risk if their bodies naturally produce high levels of male hormones, the same hormones that give them an intense sex drive. In younger men, very high ejaculation frequency might reflect extremely high androgen levels, which could potentially accelerate any existing predisposition to prostate cancer. But for men over 50, the protective effect dominates. The multivariate relative risks for men reporting 21 or more ejaculations monthly showed the strongest protective effects at ages 40 to 49, with even more pronounced benefits in older age groups. If you're over 50 and masturbating daily, the research strongly suggests you're doing something beneficial for your prostate health, not harmful. A patient in his mid-50s was worried that his daily masturbation habit was excessive. After reviewing the age-specific research together, he understood that at his age, this frequency was actually protective. His anxiety disappeared and was replaced with confidence that he was actively maintaining his prostate health. Age matters significantly when evaluating the effects of daily ejaculation. Comment below. Are you over 50? Does this research change your perspective? The physical changes inside your prostate. So what's physically changing inside your prostate when you ejaculate daily? First, reduced fluid accumulation. Your prostate constantly produces fluid. Daily ejaculation means that fluid is regularly expelled rather than accumulating. This reduces pressure inside the gland, decreases inflammation, and prevents the buildup of potentially harmful substances. Second, improved blood flow. The sexual arousal and ejaculation process increases blood circulation to your pelvic region, including your prostate. Better circulation means better oxygen delivery, better nutrient supply, and more efficient removal of waste products. This keeps prostate tissue healthier. Third, reduced inflammation markers. Studies suggest that regular ejaculation may help reduce inflammatory markers in prostate tissue. Chronic inflammation is linked to both benign prostate enlargement and prostate cancer development. By reducing inflammation, daily ejaculation may slow both processes. Fourth, maintained muscle tone. The muscles surrounding and within your prostate contract rhythmically during ejaculation. Daily contraction maintains muscle tone and function, similar to how regular exercise maintains muscle health in your body. One patient had been experiencing mild prostatitis symptoms, including pelvic discomfort and urinary urgency. After increasing his ejaculation frequency to approximately daily, his symptoms improved significantly over 6 weeks. The regular flushing and improved circulation helped reduce the inflammation causing his discomfort. These physical changes are happening inside your prostate every time you ejaculate. Now, while daily masturbation can be beneficial, there are critical mistakes that can turn this healthy practice into something harmful. Mistake number 1, inadequate lubrication. Daily masturbation without proper lubricant causes friction damage to penile skin over time. This creates micro tears, scarring, and reduced sensitivity. Always use water-based or silicone-based lubricant, especially if you're doing this daily. Mistake number 2, excessive grip pressure. Some men compensate for reduced sensitivity by gripping harder. This damages tissue and creates a negative feedback loop. Use a lighter touch and focus on varied stimulation rather than intense pressure. Mistake number 3, rushing the process. Quick mechanical masturbation doesn't provide the full prostate benefits. The arousal phase increases blood flow. The buildup phase prepares the prostate for complete emptying. Rushing through it reduces these benefits. Take your time. Mistake number 4, ignoring pain or discomfort. If daily masturbation causes pain, burning during urination, blood and semen, or difficulty urinating, stop immediately and see a urologist. These symptoms can indicate prostatitis, urethral irritation, or other conditions requiring treatment. Mistake number 5, excessive pornography dependence. If you require increasingly extreme pornography to achieve arousal, that's a neurological issue affecting your brain's dopamine system. This can interfere with real intimacy and create compulsive behaviors. I treated a patient who developed severe penile skin irritation from daily masturbation without lubricant. He thought the roughness meant he was toughening up his skin. In reality, he was causing progressive damage. After switching to proper lubrication and gentler technique, his tissue healed completely within 3 weeks. Daily masturbation is only beneficial when done correctly. The changes aren't just physical. Daily masturbation also affects your mental health and stress levels, which indirectly impacts your prostate. Ejaculation triggers release of dopamine, the pleasure hormone, along with oxytocin and endorphins. These neurochemicals reduce stress, improve mood, and promote relaxation. During ejaculation, your body releases the feel-good hormone known as dopamine, which increases feelings of happiness and relaxation. Chronic stress elevates cortisol, which has been linked to increased inflammation throughout the body, including in the prostate. By providing daily stress relief through masturbation, you're indirectly protecting your prostate from stress-induced inflammation. Daily masturbation also improves sleep quality for many men. The relaxation response following orgasm naturally prepares your body for sleep. Better sleep supports overall health, including immune function and tissue repair. One patient dealing with high-stress work and chronic anxiety started using daily masturbation as part of his bedtime routine. Within 2 weeks, he reported significantly improved sleep, reduced anxiety, and better overall mood. His stress-related prostate symptoms also decreased noticeably. Your mental health and prostate health are more connected than most men realize. Let me give you the complete framework for beneficial daily masturbation after 50. Timing. Once daily is ideal for most men over 50. This frequency provides consistent prostate flushing without overdoing it. Some men naturally prefer 5 to 6 times weekly instead of 7, and that's equally beneficial. Technique. Always use adequate lubrication. This is non-negotiable for daily frequency. Protect your tissue from friction damage. Duration. Allow 10 to 20 minutes. From start to finish. Don't rush. The arousal phase provides important blood flow benefits. The relaxation phase provides stress relief benefits. Variety. Vary your stimulation patterns. Don't rely on the same mechanical approach every time. Variety keeps your nervous system responsive and prevents desensitization. Mindfulness, be present during the experience. This isn't just about reaching orgasm quickly, it's about the full experience. Arousal, pleasure, release, and relaxation. Balance, maintain partnered intimacy. If you're in a relationship, daily masturbation should complement, not replace connection with your partner. Awareness, pay attention to your body's signals. If you experience any pain, discomfort, or functional changes, adjust your frequency or technique accordingly. Follow this framework and you're optimizing the benefits while minimizing any potential issues. While daily masturbation is generally beneficial for men over 50, there are situations where it becomes problematic if it interferes with daily responsibilities. Missing work, neglecting relationships, or avoiding social activities to masturbate indicates compulsive behavior requiring professional help. If you feel unable to stop despite wanting to, loss of control over sexual behavior is classified as compulsive sexual behavior disorder and requires therapy if it's causing physical problems. Persistent pain, skin damage, or urinary symptoms mean you need to stop and see a urologist if it's completely replacing partnered intimacy. Consistently choosing masturbation over sex with your partner indicates relationship issues worth addressing. The vast majority of men fall nowhere near these categories, but if any apply to you, seek appropriate help without shame or embarrassment. Let me bring this all together for you. For men over 50, daily masturbation creates several beneficial changes in your prostate. It flushes out potentially harmful substances, reduces cancer risk by up to 36%, improves blood circulation, reduces inflammation, maintains muscle tone, and supports overall prostate health. The research is clear and compelling. Men who ejaculate at least 21 times a month have a 20% lower chance of prostate cancer compared to those who ejaculate 4 to 7 times monthly. Daily masturbation falls right in that protective range. The key is doing it correctly. Use proper lubrication, take adequate time, avoid excessive pressure, and pay attention to your body's signals. Your prostate is constantly changing as you age. Daily ejaculation helps guide those changes in a healthy direction, reducing cancer risk and maintaining function. If this information helped you understand what's happening inside your prostate, hit that like button right now. Comment below and tell me, did this change your perspective on daily masturbation? What surprised you most? And subscribe for more honest, science-backed guidance on male health topics. I'm Dr. Ken D. Berry. Your prostate health matters, and you deserve accurate information to make informed decisions. Take care of your prostate. It's one of the most important things you can do for your long-term